Good morning, Dr. Berger. Would you be kind enough to describe the procedure you're doing and also show us what exactly you're going to be doing?
Absolutely. So our lovely patient has some issues with bruxism, grinding her teeth at night. So we're going to do a little bit of Botox, neurotoxin treatment. I'm using Xeomin in this case to basically calm down the masseter, one of one of the muscles that helps you clench your jaw, so that she'll have a little bit less grinding at night. Okay, so you're ready? Okay, so go ahead and clench. Clenching? Yeah, okay. So you're going to feel a pinch now. And release. So relax. Okay, and clench. And release. Clench. Clench. And release. Okay, so we're going to add just a few more units to this side. I like to start conservatively and not use too much on the first time, and have the patient come back and see if they need any more.
And how long does it usually happen between first and second session?
So we need to give at least 2 weeks. And within between 3 and 7 days, it should start to work, but I'd like to give at least 2 weeks before following up. Okay, ready? Go ahead and clench again. So that finishes this side.